Welcome to The Gum Guru, the podcast that helps you chew on the truth about your gums, implants, and oral health, straight from the experts at North Raleigh Periodontics and Implant Center. I'm your host, Lisa Bruff, and today we're diving into some of the wildest myths some people believe about their gums. Stuff like bleeding gums are normal and gum disease is just for old people. Dr. Singletary is here to set the record straight, and trust me, you're going to want to hear this. Let's bust some myths, Gum Guru style. All right, let's start with the big one, Dr. Singletary. Bleeding gums are normal. Why do so many people believe this, and what's actually going on when your gums bleed?
Well, if people are saying that, which, they come in and may say that a lot, that's inflammation. And that means, and I've always said, periodontal disease is the number one health problem in the world. It's the number one cause of tooth loss and can be life-threatening. Because one thing causes gum disease, bacteria. And everybody has plaque in their mouth. That's a colony of bacteria. So your immune system is going to react to it. You inherit the makeup of the saliva. You inherit your immune system. Guess what you don't inherit? The bacteria.
Right. Let's hope not.
Yes.
Okay, so bacteria can cause this. Another common one is if it doesn't hurt, it must be fine. In fact, at my age, there's a lot of things that hurt, and I still think it must be fine. Why is this such a dangerous way to think about oral health, though?
Well, I always say if it hurts, it's like high blood pressure and glaucoma. It's curtains.
Right. Oh, okay.
Yeah, so you don't want to wait till it hurts. And those signs of bleeding gums or puffy gums, it can ebb and flow. And if you notice, if you really up your oral hygiene, it'll go away. I mean, treating periodontal disease is simple. It's just a matter of understanding the nature of the beast and habit change. I have a cardiologist down east. He says, "Well, my patients can't afford to go to a periodontist. They just take the teeth out." And I said, "Can they afford a toothbrush?"
Right. Well, I know now that I've spent a lot of time with you, I have toothbrushes everywhere in my car and in my desk. It goes 4 times a day. For those of you who have not heard this yet, the Gum Guru, you need to brush your teeth 4 times a day, and make it easy because you can even do it dry. You just want to break up this film that comes over your teeth, and we all know what that feels like, that fuzzy sort of blanket over your tooth. But break that up 4 times a day and floss really good at least one of those times, and you can really help with your gum disease. Yeah.
Well, floss as much as you can, but you got to get in between the teeth. That's the thing you mentioned about floss. When you eat, food gets caught in between your teeth. Now, my younger patients don't have that problem. They haven't been around a long time. Yes, you can get gum disease in younger people, and we'll talk about that in a minute. But the gingival tissue in between the teeth, fills that space up. So normally when you're younger, you don't notice it or you don't have that food impaction as a problem. It's just as you get older, recession and day in, day out inflammation, and it goes away, it goes away. You're going to have spaces in between the teeth that if you're brushing, I say you eat twice, once during the meal and once when you floss, because you go get stuff out you just didn't know was there.
Yep. Those are always the surprising one, that last rinse where there's still one more.
Yeah.
There's some more stuff coming into the sink. Okay, well, how about we hear patients say gum disease only happens to older people. What's the reality? Can younger adults or even teens develop gum disease?
Absolutely. And that's there is a diagnosis of juvenile periodontitis, and it does happen in young individuals. Usually it's associated with front teeth and molars, and the reason why it's that is because the sequence of eruption of the front teeth and molars are first. And so when they come through the mouth, if there's bacteria there that the body doesn't like, it's going to react to it. Now, some of it's genetically determined. There is a genetic predisposition for this juvenile periodontitis that if it's not caught early enough, they will lose their teeth. And if it is caught and treated, eventually it turns over to adult periodontitis. But it's that immune response genetically that either the type of the bacteria that's growing there or that genetic predetermination that, if the parent is susceptible to gum disease, they're going to be susceptible. And at that age, early age, if that bacteria is there, you don't know it, so that's why it's so important for young individuals to get in a good oral hygiene technique.
Are there certain either seasons of life for young people or maybe medications that they're on or certain diseases that they get that make them more prone to this, where they should be a little more vigilant, or habits even, I guess?
Yeah, I mean, people who have asthma and they're doing albuterol or something that dries their mouth out, or some autoimmune issues for lupus can occur in young individuals. And as far as medication, medication for ADHD, or it can affect the salivary flow and content. So they do need to be aware of the ramifications of medication and ask their periodontist or dentist. That's why medical history is so important, that that they reveal medication they're taking. They may not want to say anything about it, but they should.
What about with women? I mean, there's, women are menstruating, they have children, they're breastfeeding. Are there times where they're more likely to have this type of gum disease?
Yeah, good question. Yes. Pregnancy gingivitis, estrogen, progestin levels are significant when you're pregnant. Now, it's interesting because when you get in your mid-50s and you start going through menopause, guess what? They treat it with estrogen and progesterone. And I was trying to figure out, okay, they were saying that estrogen and progesterone given to adult women going through menopause helps oral health. And I'm going, well, it's the same hormone that happens in pregnancy gingivitis. Well, the difference is in pregnancy gingivitis, the estrogen and progesterone level elevates so significantly that the bacteria that love it just go crazy. It's like how much you binge. They grow, and the immune system reacts to it. That's why the pregnancy gingivitis. So yes, when an individual is pregnant, it's very important, again, that they've been monitored. There used to be a wives' tale, you lose a tooth for every baby you had.
Oh, that's right. I think I heard that. I didn't realize why that was, though.
Yeah,
that's not a myth, I guess.
No, not really. I mean, talking about in the old days.
Yeah.
But during menopause, the difference is the estrogen progesterone levels go down so much that there's hardly any at all. And what the hormonal substitute does, the HR therapy, the HRT, they call it, raises up to a normal level, and a normal level helps stimulate salivary flow, and it helps normal function. So that's the difference. One is super elevation, one is getting it back where it should be. Although I had an individual in the office the other day, she was 52 and looked like she had pregnancy gingivitis, and I said, "Are you on hormonal therapy for menopause?" She said, "Yes. And in fact, I have to get it adjusted. I don't know if I've taken the right dose or not."
Oh, okay.
I think she was overdosing.
Is there something, because, now I'm over 60. It's like, is there things that I should be more aware of in terms, will my mouth change?
Oh, yeah.
Will it become more prone? Because I'm one of those people not prone to this. I mean, I did have it during pregnancy, but I'm not prone to it.
Yeah.
So.
Yeah. I mean, salivary flow will change. It just the atrophy of the salivary glands, and so you'll have dry mouth more often.
Right.
And even though saliva is what the bacteria grows in, saliva is also a lavage mechanism as well. And also the immunoglobulins in saliva. Those are little particles that grab a hold of the bacteria and allows the immune system to react to it. So if you have a reduction of salivary flow, you're not only susceptible to periodontal disease, but recurrent decay.
Does it help to drink more fluid when you're older when you do this?
Yes.
Or rinse your mouth more often? Or?
Yep. Yes.
Okay. All right, well, that's good to know. Okay. Let's talk about implants. Some people think they look fake or only for the elderly. What's the truth about modern dental implants?
There are a good alternative. It depends on the patient. We went from initially very few being placed, maybe by oral surgeons and periodontists, and now then they went through a period where general dentists, a lot of people were putting implants in. If you look the wrong way, you're going to get an implant. And, if the tooth had just a little chip, let's take it out and put an implant. We're sort of shifting back to being more cautious because they can fail. And where they're placed makes a difference in the mouth. Yes, aesthetics in the anterior region, it's difficult to get aesthetics around an implant because it's rare. The diameter of an implant recreates the natural diameter of a tooth anywhere in the mouth, but particularly in the anterior area. And gingival tissue contour It just has to be done the right way. It can look good, but it's a lot of planning goes into it. It's not just, oh, we're going to take this tooth out and put an implant in. And like I had the case the other day. They got a diagnosis and a treatment plan for immediate extraction implant placement, and the sinus is right next to the root that was being taken out, and there was only so much space to put the implant. And when you do implants, you got to have a good torque in the bone. You can't just place in a socket and think the bone's going to heal around it. You got to have good bone around it.
Right.
In this situation, it wasn't going to have good bone around it, and fortunately, the patient came in for a second opinion. I said, no, you need to stage this. So it's the things that we look at to determine if a patient is a good candidate, just the medical history, is there good width, height, and depth of bone, and are they periodontally stable? If a patient loses a tooth due to periodontal disease, they're going to lose an implant. It's at least they're going to be more likely to. It doesn't mean that implants can't be done. But it's in medications that people take, can affect bone metabolism. People with osteoporosis, they're taking bisphosphonates. It affects the bone being made and taken away. And it's, again, you have to be very cautious.
So that myth that it's only for the elderly, it may actually take better on younger people with healthier. Yes.
Yes, and because the bone is denser. The medical history is key, though. Genetic predisposition. If there's a history of thyroid problems, and it's a young person, they don't have any issues. These things need to be thought about. If their parents have osteoporosis, is this something that has to be concerned that there's a genetic predisposition? But if they get an implant in a young age, and they're taking care of it and brushing, flossing consistently, it should be fine. Trauma brings them down in gum disease, and as long as the person understands that and sticks with the program, they should be okay. Even if they start smoking again, I'm not condoning that. I'm just saying the body's dynamic. It's not static. It's constantly changing. Bones being made and taken away, and anything can affect that. Stress, medication. So just being aware of the fact that just because you got a missing tooth doesn't necessarily mean an implant's the only option. There are other options.
Right, because now, of course, they say when you miss a tooth, it's that you should put something in that space because it can cause problems. So if you're young, should you put something in that space if you lose a tooth?
It depends where it is and depends on where what's above it. It's always a good idea to replace missing teeth, yes, because you can get shifting over time, and it's the forces of occlusion on the adjacent teeth get higher if you're missing like a molar, a first molar. The teeth on either side are going to take more pressure, and they can end up cracking or fracturing if you're not careful. So yeah, replacing it is a good idea. Now, how they do it, there are 4 options: implant, bridge, or partial. Doing nothing, they probably should do something, because you don't want that shifting to occur, and you want get the forces of pressure of eating distributed better.
Okay. Sounds interesting. Sounds good. There's this persistent myth that flossing harder can fix gum disease. Can you explain why that can actually make things worse?
Yeah.
Aggressive flossing we're talking about here. We're talking about aggressive, brutal flossing.
Yeah, I mean...
Getting down in there really deep with that floss.
Yeah, you can cut yourself. Now, the type of floss you use is important. I used to say, you can use knitting yarn as far as I'm concerned, as long as you're flossing. But, I really think that the type of floss you use is important. I was flossing this morning, actually, because I was at the office, and we have cocoa floss, and I think cocoa floss is the best floss on the market. And they're not paying me anything to say this, by the way.
But they should be.
Yeah, they should. I think they did send me a box of M&Ms. I don't know, but anyway.
Sounds like a bribe.
Because I heard something on somewhere. But anyway, it's more fibrous, and it's a little bit thicker. It does go through contacts okay. Is
it from coconut fiber?
It's made. It comes from Florida, and it's people. And I guess they
had
a Florida motif, but it's the fibers tend to wick the bacteria up into it, and it covers more surface area. It's probably the last floss that shreds when you go through a contact. Now, if you have floss that shreds going through a contact, if it's so tight, Glide or Teflon floss. But the problem with floss, like you're talking, you floss too hard. The floss I had this morning, it was a promotional floss, and it was very thin, and it could cut your gum if you're not careful. You go straight down.
I've had some of those. Where, they're really not nice.
If you're not careful, you can slice the gum, and so you have to go in and pull toward the tooth and then go up and down. If you just go straight in, I'll pop it through. You can damage the tissue. It will heal, but it'll be tender. The cocoa floss, I haven't had that sensation as much because it's not as sharp. You see these movies where people are in jail and they take real thin floss or something, and they go through the
bars, right?
Through the bars. You can't do that with cocoa floss.
Yeah. Plus, I like the flavors, and they have flavors like they've got chocolate and chocolate mint. They've got pineapple, I think, coconut. Yeah, the flavors are great. The colors are good too. So if you're a big TikTok fan, you can probably find a cocoa floss to match your aesthetic. Finally, let's bust a myth that oral health and overall health are just not connected. And I always thought, why do we not have a more aggressive insurance covering, oral health, because it does connect it. But what are some real medical risks that are linked to gum disease?
Yeah, well, that's a good question. And so, yes, there are 11 species of bacteria that doesn't like oxygen. And you have Prophylaemus gingivalis. These are fancy words, but they can do things like affect the heart. First of all, the inflammatory mediators, when you have plaque growth in your mouth and your body reacts to it, it's just amazing how fearfully wonderfully made we are. Our immune system is trying to protect us, but in doing so, when the white blood cells engulf the bacteria and kill it, it splits and it kills the bacteria, but destroys everything in the area: gum tissue attachment, bone. And then sends mediators into bloodstream to bring more white blood cells. So those mediators are interleukins and bradykinins. They're inflammatory mediators that irritate the arterial linings and cause atherosclerosis or buildup of arterial plaque, and that can affect your heart. And then Prophylaemus gingivalis, rheumatoid arthritis. They found Treponema denticola, which is a spirochetal organism, and they found it in the brain producing amyloid, causing dementia. Guess where it comes from? Plaque.
From plaque.
So it is a systemic involvement, and it's not necessarily subtle, because every time you chew, you have bacteria showers in the bloodstream. It takes a minute to go from your mouth to your toes. So your immune system protects you and helps you, but the less opportunity for those bacteria to grow, the less opportunity to affect your systemic health. And what's the most inexpensive way to treat health in general?
A toothbrush and floss.
Yeah, exactly.
Right.
I mean, I'm thinking about designer toothbrushes, so that you just
should make it cool.
You bring it up and brush your teeth, and you rinse it off, and you're good. But no, it's the American Dental Association that tells the dentist tell the patient to brush twice a day, and that's good. But that's an old World War II mandate. That's where the federal government commanded the enlisted men to brush twice a day. But it's you need to. The more you brush, the better off you are. I've never seen anybody lose a tooth by brushing too much.
I think they worry about the
Reception.
Coating on the tooth that you can break. What is that called?
Or the enamel.
The enamel. The people are worried about bracing their enamel by brushing too often. Not going to happen? Is that a myth? Also a myth?
No, it's not necessarily. If you use a hard bristle brush or use even a soft bristle brush, I just say, I'll tell that can scrape rust off nails. You need extra soft brush. But there are other things that go on that affect the enamel and cement them on the root. Acid reflux, acid pH, acidity in your food. Your toothbrush, I mean, some people say you shouldn't brush right after you eat because it's the acidic environment, because of with the salivary flow and the pH goes down because the enzymes are digesting the food. Well, how do you counteract acidic pH? With base. What's water? It's basic.
Oh, it's base. Okay,
so you just rinse the water and
another
brush.
myth. That's another myth.
Yeah.
Another myth. Yep. Okay, for anyone who's been avoiding the periodontist out of fear, what do you want them to know today about experience at your office?
Well, first of all, I like to talk, but I like to educate. And it's not, ignorance is not bliss.
Right.
The more knowledge you have, you can go to Google and ChatGPT this day and age and get your questions answered, but everybody's different. You can't cookbook periodontal therapy. Everybody's medical history, everybody's experience, their stress they experience, everything is different. And so being able, when you come to our office, I blend the medical history, which is very important, and the oral exam. It's just not just the mouth, it's head and neck and the whole thing, and the radiographs. And there's a story there, and I like to interpret the story. So when you come to our office, I'm going to figure out the story for the patient. And it's, they may come in with a specific problem, but and we'll address that. But also around that, what are the ramifications? What are they going to have to do? How they're going to invest it? Is this going to be a good investment? Sometimes they don't like to hear what I say because, I've been doing this a while, so I know sort of what can work and what can't work. I've been proven wrong a couple of times, but most of the time I have a pattern that I see that, well, by the way, I wouldn't do this. Like, for instance, some individuals, oral surgeons, use bovine bone when they take teeth out to put in the extraction site for future implant placement. Well, bovine bone is great. It initially heals up dents and nice, and it's good to put an implant in, but it devitalizes in about 20 or 30 years.
Oh, okay, so it's not permanent necessarily.
No, not necessarily. And long-term
So,
studies.
okay if you're 60, not so good if you're 25.
Exactly.
That makes a difference.
Yeah.
Plus, I can tell you that they're very gentle there. Even the cleanings, they have that special the airflow. I love that thing. It's warm water, and it's not like that sharp needle cold water. And it cleans a lot of the stuff off the teeth before they even get to the scraping, and the scraping gets everything off. And it was really a very painless, much more comfortable just in the cleaning itself. You all really focus on making everybody comfortable there.
Well, thank you. We're going to change our name to North Raleigh Perio Implant Spa Center, and
Yeah.
maybe somebody do your feet while you do your
I
head.
love that. I would come in more often if we get the feet done at the same time. Okay, so we're down to where we have the homework. Now we're talking about myth busting today. So what's some things maybe that they should or shouldn't do in terms of, learning about what is true or false about their dental health?
Well, don't ignore it. It's not going to go away. It might go away, but there's damage that occur. If you feel something, then address
Say something, right?
Yeah. But there's no better action than just make sure you're consistently going to your dentist or periodontist, and don't. Life happens and you get out of sequence, but things will happen when you do that, and it may not hurt. It may be because, like I
Tracy
said,
says if it doesn't hurt, it doesn't matter. Just wake up, it's too late. That's good. All right. The truth is your gums are a big deal. And when you've got the facts, you can make smart choices for your health, your smile, and your future. Thanks so much to Dr. Macon Singletary from North Raleigh Periodontics and Implant Center for dropping some serious truth on us today. If you've been holding on to some of these myths or avoiding care out of fear, it's time to get some real help from people who care. Find your true north of periodontics, North Raleigh Periodontics, at northraleighterio.com. And don't forget to follow the Gum Guru for more myth-busting, smile-saving episodes. Until next time, keep those gums healthy.